I'm Dr. Jean Liljegren. I graduated from University of Minnesota way back in 1986. And then I took the acupuncture course through the International Veterinary Acupuncture Society, IVAS, and received my certification in 2002, I believe. So I've been doing this for 20 years. And dachshunds are like my fave because A, they tend to have back problems and I can help better than just medications can. So I really enjoy being able to do this and add this, on my tool belt. This works. There's the brain and then there's the spinal cord. And the spinal cord branches. At the end of each branch, and I'll pretend that my arm is a nerve, is something called a neuron. So it's a little bit of a bigger piece, and it's responsible for sending a signal up that nerve to the brain. So when I put back up, there's electricity in the nervous system, right? It's very mild, but there is electricity. So I take a stainless steel needle over the top of a neuron, and there's going to be something called ion exchange, which excites the neuron because you've got metal and you've got electricity. So that sends a signal, that excites this, sends a signal to the brain that says we need chemicals. And the brain knows what it needs. Endorphins probably being the most commonly known one. This one is longer, but it's actually the same diameter. So some of the points, like the points on his back, are going to be deeper than points on his elbows or on his head. So I use the shorter ones when there's not as much meat, over the point. So that's why the two different ones. And look how good he is. A lot of elderly dogs with arthritis. That's probably my most common thing, but also for any kind of orthopedic issue. In Reese's case, he's got disc disease, so he's got a back problem. So that's a lot of what I'm treating him for. But I don't just treat his back, as you know. I'm putting needles in the front end, I'm putting them around his ears, I'm putting them all over just to A, help his immune system, and B, just to help his well-being. It's kind of a generalized thing, but I've used it for seizures is a common thing. I love using it for seizure dogs. My favorite case was a I don't remember how old he was, Brittany Spaniel, and he had come to me after going to the neurologist at the university, and he was on, I don't know, 4 or 5 different medications. She had to set a timer to remember when to give all his medicines. And we did, after like 3 treatments, and all I did was add 1 herb and the acupuncture, he went like 8 months without a seizure, and he was having several seizures every day, even on the medicine. So she was thrilled, I was thrilled, the dog was thrilled. So that was probably my most dramatic case. Which, there's very few dogs that won't respond, but there are a few dogs that won't sit still. Like they're trying to bite me, so you have to put a muzzle on them, and then they're so flipped out that they can't relax enough to get the endorphin rush. Right, okay. But they're few and far between. I even have cats that I can do. Oh, wow. And cats will only let you do so many points. I can't do as many. But you just listen to them and try to figure out what they're willing to let you do. It depends, is what my instructor used to say. If you have a chronic condition like Reese's, it's not probably going to get cured in one session. But what you're looking for is most especially with these geriatric kids, is overall just feeling better. Like their appetite's better, they're up and moving in the morning, their happiness factor goes up, I guess. And of course, if there's a lameness, you can see hopefully the lameness is better. If they're paralyzed, hopefully the paralysis gets better, but it may take 2 or 3 or maybe 4 treatments to see that. Again, it depends. If I have a really sore, painful, paralyzed dog, I might see him twice a week. For a dog who's really stable, the dachshund I had before, she's doing great. she's going to come every 6 weeks just for maintenance. So it really does depend on what I'm treating as to how often. And I usually encourage people to give me 4 treatments before they decide, oh, it's just not doing anything, or it's not doing what I expected it to do. So what we're going to do is hook up leads to the needles, and then we put the leads in, attach here. What these do is stimulate the points more quickly, I guess is what I'm trying to say, or more completely, by just adding a little bit more electricity than what's being done. There are cases that I can't use electrostim. Somebody who's got cancer, somebody who is epileptic and has seizures. They don't recommend using electricity. Those are probably the only 2 situations, or if the dog just doesn't like it, which is weird, but it happens occasionally. Reese's is often good for whatever we do. They can feel the needles, you know, I mean, they're just sort of there. But dogs do shake generally. They do not hurt your dog. I have not had any long-term side effects. Occasionally there will be a little bit of a bruising where you put a needle. That would be the only hurting that could happen.
Okay.
From the points. There are certain points you do not use because they can be risky. That's the nice part about this compared to using some medications where they can have untoward side effects. The only side effect this may have would be, and maybe Reese's does this, he goes home and he sleeps and crashes for several hours. In 4,000 years. China, they developed it pretty well, although there were some other countries like India that had their own methods. But the Chinese, they found people who could tell you what's different. So if I put a needle here, I feel this, you know, like people who are just hypersensitive. And then they pulled that over to their horses, which were both their farm animals, you know, working animals, plus their warrior, you know, the warriors would ride the horses. 30 to 40 minutes. Takes a little longer the first session or 2, as I'm trying to figure out which points would be the best for the patient. And then cost-wise, it's $60, includes your electrostim and however many needles we need to use and however long it takes.
Okay.
If you go on the IVIS website, you can look at Find a Veterinarian and put in your zip code.
Okay.
And it will help you find vets in your area that will do it.